Hey, did you hear or feel a pop in your finger the last time you were climbing? It might be the dreaded pulley rupture. I'm going to show you one way you can take a quick assessment to see whether it might be a pulley or it might be something else. My name is Aaron Shaw. I've been working with climbers since 1996. I've worked with elite level climbers, intermediate, weekend warriors, and also people who are just barely getting their feet off the ground for the first time. For a little bit of peace of mind, you can have a popping sound in your hand and it not be a ruptured pulley. So one thing I want you to do is, we'll assume that it's your ring finger because it's the most common area for a pulley to rupture, most common finger. You're going to palpate, kind of pinch on the sides of the finger. So if you pinch on the sides, and if you recently ruptured a pulley, it's probably going to be pretty point tender. It's going to be like poking a bruise. So if while doing that, that's a little bit of a red flag. If while holding the side of your finger and you're bending back and forth, if you feel something that may be almost like a clicking sensation, that too might be a sign that you have some of these fibers around the pulley that are a little frayed, a little damaged and inflamed. And again, that's something that might indicate that. There are several other reasons that can lead to, that can be the result of a popping sound. Sometimes it's the joint. Sometimes you may feel pain radiating up into the palm without any sort of clicking, and maybe even without tenderness on the sides, basically the sides where these pulleys attach. So you might have point tenderness, you might have joint damage, you might not have any point tenderness at all, but instead you just have discomfort radiating up into the palm when you move. Those are very different things that can be, or very different causes, very different indicators of tissue damage. If you want to find out exactly what your popping sound was, see how serious it is, see when you can get back on the wall where you need to be, click the link associated with this video, set up a video consult with me. We'll find out exactly what's going on and what your next steps are.